Dear audience, thank you for coming today. Let me introduce my PhD topic, which is Novel Insights into the Oral Systemic Health Axis. My name is Ellay Gutmacher. I'm a DMD PhD student. My supervisors are Andrea Brody and Ako Jembery. My SMS is Esther Salai Agnesh. My vision is to facilitate global healthcare by better understanding the oral systemic health axis, and my mission is to do it by providing an evidence that saliva can detect systemic diseases. Currently, we have two ongoing projects. And the first one is investigating the salivary levels of Fusobacterium nucleatum in patients with colorectal cancer. And this is done by the methodology of systematic review and meta-analysis. The co-author for both of my projects is Balin Jombor Sharai. So colorectal cancer causes more than 930,000 deaths per year, and this is estimated to increase to more than 1.6 million deaths by 2040. Screening tests such as colonoscopy can prevent early colorectal cancer by detecting malignant polyps and removing them. However, unfortunately, colonoscopy has some limitations such as geographic barriers that contribute to the late diagnosis of the disease. In addition, it is an invasive, uncomfortable, and potentially it can harm the patient. Just as an example, in the USA, nearly 22 million risk individuals have never been screened for colorectal cancer. So we know that Fusobacterium nucleatum is an oral pathogenic bacteria that is associated with periodontitis. It was found also to accelerate different types of cancer, such as breast and pancreatic cancer. A recent study showed that the bacteria is found in the colorectal tissues of patients with colorectal cancer and polyposis, and also that the higher the abundance of the bacteria in those tissues, the lower the survival rate of the patient. Therefore, we suggested a novel method to detect colorectal cancer using saliva samples from which we can quantify the DNA levels of the bacteria. Our vision was that risk individuals would be able to diagnose themselves from home using those simple saliva samples, and by that we aimed to provide an excellent tool to increase the detection rate of colorectal cancer. This is why our aim was to investigate the diagnostic and prognostic value of salivary FN in colorectal cancer. So we asked, is there a difference between colorectal cancer and healthy or precancerous patients in the salivary FN DNA levels? To answer these questions, we used the PECO and PER framework, the PECO framework to investigate the association between the bacteria in saliva and colorectal cancer patients, and we hypothesized for this that patients with colorectal cancer have significantly higher levels of salivary FN compared to healthy individuals or precancerous patients. And to investigate the diagnostic accuracy of the bacteria to detect colorectal cancer patients, we used the PERT framework, and for that we hypothesized that salivary FN can accurately predict and diagnose colorectal cancer. We conducted our systematic search on November 25, 2023 in 4 databases with the following search key that is composed of 4 domains. And we started with more than 14,000 studies and finished with 12 eligible full texts. And allow me to introduce our results. So here we investigated the presence of Fusobacterium nucleatum in saliva among colorectal cancer patients and control groups. This is very important because patients with colorectal cancer usually show symptoms at the late stage of the disease. So the early detection can open up more treatment options, and also it can increase the likelihood of successful operations. And by that, it can save lives. So to assess this outcome, we used the odds ratio with 95% confidence interval, and we included 8 prospective cohort and case control studies with more than 1,000 patients divided into the healthy and polyposis control subgroups. The heterogeneity was 0%, which is very low heterogeneity between the studies. And the pooled odds ratio for the presence of bacteria in saliva, of this bacteria in the saliva, is 49% higher in patients with colorectal cancer. And this could be clinically relevant. However, unfortunately, it did not reach the statistical significance. Here we investigated the relative abundance of the FN in saliva among colorectal cancer patients and control groups. To assess this outcome, we used the mean difference with 95% confidence interval. And here we included 5 prospective cohort and case control studies with almost 500 patients divided into the same control subgroups, and the heterogeneity was 0% as well. And the pooled mean difference for the relative abundance of the bacteria in saliva is minus 0.04, which is neither statistically nor clinically relevant. The strength of our study was its novelty. It focuses on vulnerable population. We could include individual patients' data that allowed us to interpret the results further, and we included studies from diverse continents. However, the limitations were the differences in the measurement of the bacteria in saliva, and also the low number of eligible studies. So based on our results, we could conclude that the presence and relative abundance of salivary FN are not associated with colorectal cancer. For the practice, we implied that salivary FN alone as a biomarker should not be recommended in the guideline to detect colorectal cancer. And for the research, we implied that other non-invasive markers that can replace colonoscopy should be investigated. We submitted our study to the Scientific Reports Journal, and currently it is under review. And our second project is evaluating the diagnostic accuracy of salivary C-reactive protein in neonatal sepsis, again by the methodology of systematic review and meta-analysis. So every year about 3 million children die in the first month of their life, and about 98% of those deaths occur in developing countries. Neonatal infections, including sepsis and meningitis, are responsible for about 400,000 deaths per year, with a mortality rate that is ranging from 9 to 20% in the case of severe neonatal sepsis. The signs and symptoms of the disease are nonspecific, and this very often leads to unnecessary antibiotic treatment to the neonates. We know that serum CRP plays an important role in the treatment decisions of neonates with suspected sepsis before receiving the blood culture results. However, it requires blood sampling, whose processing may take several days due to laboratory support, and in addition, it leads to phlebotomy losses that cause moderate pain in the neonate. A recent study showed that CRP could be easily and non-invasively obtained from saliva, and also that it can accurately detect neonatal sepsis. Therefore, our aim is to investigate the efficacy and performance of salivary CRP to diagnose neonatal sepsis. So, our clinical question: could salivary CRP accurately detect sepsis in neonates? To answer this question, we used the PERC framework, and we hypothesized that salivary CRP can diagnose neonatal sepsis accurately. And our clinical implication is that salivary CRP can accelerate neonatal sepsis detection. We conducted our systematic search last year in 3 databases with the following search key. And we started with more than 5,000 articles, and currently we're at the stage of full text selection. And to summarize everything, the first project was submitted 2 days ago, and the second project we plan to submit later this year. And I would like to thank you with a quote from Albert Einstein: "The most beautiful thing we can experience is the mysterious. It is the source of all true art and science." Thank you.
What would be recommendations or implications for policymakers?
Thank you for your question. So, by policymakers, you mean for researchers? So, as we said, yes? No. Okay. Yes, okay. So, currently, the clinical implication is that salivary Fusobacterium nucleatum could not be used as a biomarker. According to my knowledge, it is not used anyway, but there were few studies that were investigating it. And from our conclusion, we could see that there is no relation, so it could not be used. So, of course, our implication would be to stick to colonoscopy, but even if it was associated, we would still think that colonoscopy is the gold standard for this.
Do you see any other bacteria which might be related to this or worthwhile to investigate?
Yes, thank you for your question. There are a lot of bacteria that are investigated. One that I could see that was, I think, shown in 2 studies is Streptococcus galolyticus, which was found to also have association, but the most popular one and the common that we could see is Fusobacterium nucleatum.
And what was the original idea from somebody that they came up with this idea that Fusobacterium in the salivary has connection to the cancer?
Yes, thank you for your question. So this idea came from my supervisor, Dr. Rako Zsemberi, and he thought about it because he saw in the literature previous researchers about these specific bacteria. So that's why we wanted to investigate specifically this bacteria. That was your question, right?
Yeah, but what is the mechanism behind of the idea? That what is the connection? What could be the connection?
Yes, okay, so thank you for your question. So the bacteria is, as I said, oral pathogenic bacteria associated with periodontitis. So there are 2 mechanisms in which it reaches the colorectal cancer. The older one is by, the older research says that it is reaching the colorectal cancer tissue by swallowing, through the saliva, swallowing, and it reaches the colorectal cancer. And the second research said that it reaches to the colorectal tissue through hematogenous spread. So from the periodontal tissues to the bloodstream and to the colorectal tissue.
And the bacteria has a special affinity for the colon part, or why?
Their previous researches showed that it is found in higher amount in the colorectal tissues of patients with cancer in the colorectal tissues. Also, it can also accelerate the progression of the colorectal cancer.
So basically, the conclusion is that the salivary is not a good source for the marker, but maybe the blood or...
Correct. And also fecal samples was seen to have a good...
It makes sense. Thank you.
Thank you.